Title slide. Title of presentation: Improving your listening skills as a doctor or nurse. This is a section break. Introduction. In the coming slides, we will go through the importance of effective communication in healthcare and explanation of the role of listening in effective communication. Why listening is important. Establishing trust. When patients feel heard and understood, they are more likely to trust their healthcare provider. This can lead to better patient satisfaction, improved outcomes, and increased adherence to treatment plans. Accurate diagnosis. Accurate diagnosis relies on a thorough understanding of the patient's symptoms and medical history. Active listening can help healthcare providers gather this information and make an accurate diagnosis. Improved communication. Effective communication is crucial in healthcare to ensure that patients understand their diagnoses and treatment plans. Active listening can help healthcare providers communicate clearly and understand the patient's needs and concerns. Better patient outcomes. Active listening can lead to better patient outcomes by improving patient satisfaction, adherence to treatment plans, and trust in healthcare providers. Patient-centered care. Active listening is a key component of patient-centered care, which focuses on meeting the individual needs and preferences of each patient. By actively listening to patients, healthcare providers can provide personalized care that takes into account the patient's unique circumstances and goals. Effective listening is a critical skill for healthcare providers, but there are several obstacles that can hinder this process. Some of the common obstacles to effective listening in healthcare include time pressures. Healthcare providers are often busy and have limited time with each patient. This can make it difficult to give patients the attention they need and can lead to rushing through appointments, which can result in missed information. Preconceived notions or biases. Healthcare providers may have preconceived notions or biases that can affect how they listen to patients. This can result in assumptions about the patient's condition or treatment options, which can lead to misunderstandings or misdiagnosis. Language barriers. Language barriers can make it difficult for healthcare providers to understand the patient's needs and concerns. This can lead to misunderstandings, missed information, and inadequate treatment. Technical language. Healthcare providers may use technical language that patients may not understand, which can lead to confusion and misunderstandings. Emotional barriers. Patients may be experiencing emotions such as fear or anxiety that can make it difficult for them to communicate effectively. Healthcare providers need to be aware of these emotional barriers and provide a supportive and empathetic environment to help patients feel comfortable and communicate effectively. Multitasking. Healthcare providers may be required to multitask during appointments, such as filling out electronic medical records or attending to other patients. This can make it difficult to give patients the attention they need and can result in missed information. Time pressures, preconceived notions or biases, language barriers, technical language, emotional barriers, and multitasking are all common obstacles to effective listening in healthcare. It is important for healthcare providers to be aware of these obstacles and take steps to overcome them to ensure effective communication with their patients. Effective listening is a critical skill for healthcare providers to ensure that they can accurately diagnose patients, provide appropriate treatment, and establish trust with patients. Here are some tips for effective listening in healthcare. Give the patient your full attention. Eliminate distractions, such as electronic devices, and focus on the patient. Make eye contact and avoid interrupting the patient. Be present in the moment. Avoid thinking about other patients or tasks while you are with the patient. Stay in the present moment and focus on the patient's needs and concerns. Listen actively. Listen to the patient's words and pay attention to their body language and tone of voice. Encourage the patient to share their thoughts and feelings and use open-ended questions to gather more information. Clarify and confirm. Clarify any misunderstandings or unclear information with the patient. Confirm that you have understood the patient's concerns and needs by summarizing the information back to them. Use reflective listening. Reflective listening involves paraphrasing the patient's words back to them to show that you understand their concerns. This can help build rapport and trust with the patient. Be empathetic. Empathy involves understanding the patient's perspective and feelings. Show empathy by acknowledging the patient's emotions and concerns and responding in a supportive manner. Avoid judgment. Avoid making assumptions or judgments about the patient based on their appearance, background, or medical history. Treat every patient with respect and without judgment. Use plain language. Use plain language when communicating with patients to ensure that they understand the information. Avoid using technical terms or medical jargon that may be unfamiliar to the patient. Effective listening in healthcare involves giving the patient your full attention, being present in the moment, actively listening, clarifying and confirming information, using reflective listening, showing empathy, avoiding judgment, and using plain language. These tips can help healthcare providers build rapport with patients, establish trust, and provide high-quality. Focusing on the speaker is important for effective communication and active listening. It shows respect, improves understanding, builds rapport, prevents misunderstandings, and enhances problem solving. Healthcare providers should make a conscious effort to focus on their patients when communicating with them to ensure effective communication and high-quality care. Shows respect. Focusing on the speaker shows that you respect them and value what they have to say. It sends a message that their thoughts and feelings are important to you. Improves understanding. Focusing on the speaker helps you understand their message more clearly. You can pick up on nonverbal cues, such as body language, tone of voice, and facial expressions, which can help you understand the speaker's emotions and intentions. Builds rapport. Focusing on the speaker helps build rapport and trust. When you give someone your full attention, they are more likely to open up and share their thoughts and feelings with you. Prevents misunderstandings. Focusing on the speaker can prevent misunderstandings by ensuring that you hear their message accurately. You can ask clarifying questions and confirm your understanding to avoid miscommunication. Enhances problem solving. Focusing on the speaker is important for problem solving. When you understand the speaker's perspective, you can work together to find solutions that meet their needs. Distractions can have a significant impact on listening and communication. They can lead to missed information, reduced comprehension, poor recall, reduced empathy, and impaired problem solving. It is important for healthcare providers to eliminate distractions and give their full attention to the speaker to ensure effective communication and high-quality care. Missed information. When you are distracted, you may miss important information that the speaker is conveying. This can lead to misunderstandings and errors in communication. Reduced comprehension. Distractions can reduce comprehension by making it difficult to focus on the speaker's message. This can make it more challenging to understand complex or technical information. Poor recall. Distractions can also lead to poor recall of the information that was conveyed. This can make it difficult to remember important details such as a patient's medical history or treatment plan. Reduced empathy. Distractions can reduce empathy by making it difficult to pick up on nonverbal cues that indicate the speaker's emotions and intentions. This can make it challenging to build rapport and trust with patients. Impaired problem solving. Distractions can impair problem solving by making it challenging to understand the speaker's perspective and needs. This can make it more difficult to develop effective solutions and treatment plans. Builds trust. being present shows that you are fully engaged and invested in the speaker's needs and concerns. This can help build trust and rapport with patients and colleagues. Improves understanding. Being present helps you understand the speaker's perspective more clearly. You can pick up on nonverbal cues, such as body language, tone of voice, and facial expressions, which can help you understand their emotions and intentions. Enhances empathy. Being present can enhance empathy by helping you connect with the speaker on an emotional level. This can help you better understand their experiences and needs, and respond with compassion and sensitivity. Reduces errors. Being present can help reduce errors by ensuring that you hear and understand the speaker's message accurately. This can prevent miscommunications and mistakes in diagnosis, treatment, and care. Fosters collaboration. Being present fosters collaboration by creating an environment of openness and mutual respect. This can encourage patients and colleagues to share their thoughts and ideas, leading to more effective problem-solving and decision-making. Here are some tips. Eliminate distractions, turn off your phone and other devices, close your laptop, and avoid multitasking when communicating with patients or colleagues. Listen actively, listen with an open mind, and pay attention to both verbal and nonverbal cues. Encourage the speaker to share their thoughts and feelings, and ask questions to clarify your understanding. Be empathetic, put yourself in the speaker's shoes, and respond with compassion and sensitivity. Show that you understand and care about their experiences and needs. Use appropriate body language, maintain eye contact, face the speaker, and use positive body language, such as nodding and smiling, to show that you are engaged and attentive. Respond appropriately. Respond to the speaker's message in a way that is respectful, thoughtful, and relevant. Provide feedback and ask questions to ensure that you have understood their message accurately. Avoiding assumptions is critical to effective communication in healthcare. Assumptions are beliefs or judgments that we make without evidence or sufficient information. In healthcare, assumptions can lead to misunderstandings, misdiagnosis, and even harm to patients. Prevents miscommunication. Assumptions can lead to miscommunication by causing healthcare providers to misinterpret the patient's message or to convey information inaccurately. Enhances empathy. Avoiding assumptions can help healthcare providers approach patients with an open mind, without preconceived notions or biases. This can enhance empathy and promote patient-centered care. Increases accuracy. Avoiding assumptions can help healthcare providers gather accurate information and make informed decisions. By seeking clarification and verifying information, healthcare providers can reduce the risk of error or misdiagnosis. Builds trust. Avoiding assumptions can help build trust with patients and colleagues. It signals that healthcare providers are attentive, respectful, and committed to providing high-quality care. Here are some tips to avoid assumptions. Ask questions. Instead of making assumptions, healthcare providers should ask patients and colleagues questions to clarify their message or to gather more information. Listen actively. Healthcare providers should listen actively to patients and colleagues without interrupting or jumping to conclusions. Avoid stereotypes. Healthcare providers should avoid making assumptions based on stereotypes or generalizations. Instead, they should approach each patient and colleague as an individual, with unique needs and circumstances. Seek feedback. Healthcare providers should seek feedback from patients and colleagues to ensure that they have understood their message correctly and to address any misunderstandings. Practicing empathy is essential for healthcare providers to build strong relationships with patients and provide high-quality care. Empathy is the ability to understand and share the feelings of others. It involves putting oneself in the patient's shoes and seeing the world from their perspective. Improves communication. practicing empathy can help healthcare providers communicate more effectively with patients. It can help them understand the patient's concerns and fears and respond with compassion and sensitivity. Enhances patient-centered care. Empathy is a key component of patient-centered care, which prioritizes the patient's needs and preferences. By practicing empathy, healthcare providers can provide care that is more personalized and responsive to the patient's unique circumstances. Reduces stress. Practicing empathy can help healthcare providers manage stress and avoid burnout. It can help them connect with patients on an emotional level and find meaning and purpose in their work. Builds trust. Patients are more likely to trust healthcare providers who show empathy and understanding. This can lead to better communication, improved patient satisfaction, and better health outcomes. How can healthcare providers practice empathy in their interactions with patients? Here are some tips. Listen actively. Healthcare providers should listen actively to patients without interrupting or judging. They should try to understand the patient's perspective and show that they care. Use open body language. Open body language, such as maintaining eye contact and using open posture, can signal approachability and empathy. Validate feelings. Healthcare providers should acknowledge the patient's feelings and show that they understand. This can help patients feel heard and supported. Show compassion. Healthcare providers should show compassion and kindness in their interactions with patients. Simple gestures such as a smile or a gentle touch can go a long way in building trust and rapport. Body language is an important aspect of communication in healthcare. It refers to nonverbal cues, such as facial expressions, gestures, and posture, that can convey emotions, attitudes, and intentions. Here are some reasons why using body language is important in healthcare. Enhances understanding. Body language can help healthcare providers convey their message more effectively and help patients understand their intentions. It can also help patients express their needs and concerns more clearly. Builds rapport. Using appropriate body language can help rapport with patients and create a more relaxed and comfortable environment for communication. This can lead to better patient satisfaction and trust in the healthcare provider. Provides reassurance. Body language can provide reassurance to patients and signal that the healthcare provider is listening, attentive, and compassionate. Facilitates diagnosis. Body language can provide important clues about a patient's health status and emotional state. Healthcare providers can use this information to make a more accurate diagnosis and provide appropriate treatment. Healthcare providers can use body language effectively in their communication with patients. Here are some tips. Maintain eye contact. Eye contact is a powerful way to establish connection and show attentiveness. Healthcare providers should try to maintain eye contact with patients while speaking to them. Use open posture. Open posture, such as uncrossed arms and legs, can signal approachability and receptiveness. Healthcare providers should use open posture to make patients feel more comfortable. Use appropriate gestures. Gestures can help reinforce verbal communication and convey emotions. Healthcare providers should use appropriate gestures, such as nodding or using hand gestures, to support their message. Show facial expressions. Facial expressions can convey a range of emotions, such as empathy, concern, or reassurance. Healthcare providers should use appropriate facial expressions to convey their emotions and to respond appropriately to the patient's emotions. In summary, using body language is an important aspect of communication in healthcare. By enhancing understanding, building rapport, providing reassurance, and facilitating diagnosis, healthcare providers can improve patient outcomes and satisfaction. Healthcare providers should use body language effectively by maintaining eye contact, using open posture, using appropriate gestures, and showing appropriate facial expressions. Being patient is an important aspect of effective communication in healthcare. It refers to the ability to remain calm, composed, and attentive in the face of challenges, such as dealing with difficult patients, managing conflicting priorities, or navigating complex medical issues. Here are some reasons why being patient is important in healthcare. Builds trust. Patients are more likely to trust healthcare providers who are patient, compassionate, and attentive. Being patient can help build rapport and trust with patients, which can lead to better outcomes and patient satisfaction. Reduces errors. Rushing or being impatient can lead to mistakes in diagnosis, treatment, or communication. Being patient can help healthcare providers take the time they need to gather accurate information, make informed decisions, and communicate effectively with patients. Improves outcomes. Being patient can lead to better outcomes by allowing healthcare providers to take a more thoughtful and comprehensive approach to care. This can lead to better treatment outcomes, reduced complications, and improved patient satisfaction. For healthcare providers to be more patient in their communication with patients, here are some tips. Take time to listen. Patients often have complex medical histories and concerns that require time and attention to fully understand. Healthcare providers should take the time to listen to patients and ask open-ended questions to gather as much information as possible. Communicate clearly and calmly. Being patient requires effective communication that is clear, concise, and calm. Healthcare providers should use simple language, avoid jargon, and speak in a calm and reassuring tone. Practice mindfulness. Mindfulness is the practice of being present in the moment, without judgment or distraction. Healthcare providers can practice mindfulness techniques, such as deep breathing or meditation, to stay centered and focused during interactions with patients. Manage expectations. Patients may have unrealistic expectations or demands that can be challenging to manage. Healthcare providers should set clear expectations, explain limitations, and offer realistic solutions to help manage patient expectations. Recognizing cultural differences is an essential aspect of effective communication in healthcare. Here are some reasons why it is important. Promotes understanding. Healthcare providers who recognize cultural differences can better understand the values, beliefs, and attitudes of their patients. This understanding can lead to more effective communication and better outcomes. Reduces misunderstandings. Cultural differences can lead to misunderstandings and miscommunication between healthcare providers and patients. By recognizing these differences, healthcare providers can avoid misunderstandings and work to ensure effective communication. Respects diversity. Recognizing cultural differences shows respect for the diversity of patients and acknowledges that there is no one-size-fits-all approach to healthcare. Healthcare providers can recognize cultural differences in their communication with patients using following. Learn about the patient's culture. Healthcare providers should take the time to learn about the cultural background of their patients, including their customs, beliefs, and values. This can help providers understand the patient's perspective and tailor their communication accordingly. Avoid stereotypes. Stereotypes can lead to assumptions and misunderstandings. Healthcare providers should avoid making assumptions about a patient based on their cultural background and treat each patient as an individual. Be respectful. Healthcare providers should be respectful of the patient's culture and avoid behaviors that may be considered disrespectful or offensive. For example, some cultures may have different customs regarding eye contact, physical touch, or personal space. Use professional interpreters. If a patient does not speak the same language as the healthcare provider, it is important to use a professional interpreter to ensure effective communication. Family members or friends should not be used as interpreters, as they may not be able to provide accurate or impartial interpretation. Showing empathy and compassion is critical in healthcare to build trust, improve patient outcomes, and increase patient satisfaction. Active listening, nonverbal cues, acknowledging emotions, using positive language, and showing patience and understanding are all important ways to show empathy and compassion. Conclusion. Recap of the importance of effective listening in healthcare. Summary of key tips for improving listening skills. You may refer to above for further reading. Let's start with MCQs. What is active listening? A. Listening passively. B. Fully engaging with the speaker and demonstrating that we are listening and understanding their message. C. Interrupting the speaker. D. Providing unsolicited advice. Answer B. What is a common barrier to effective listening? A. Active listening. B. Empathy. C. Body language. D. Assumptions. Answer D. What is a technique for showing empathy in active listening? A. Interrupting the speaker. B. Making eye contact. C. Providing unsolicited advice. D. Dismissing the speaker's concerns. Answer B. What is a type of nonverbal cue for effective listening? A. Interrupting the speaker. B. Nodding. C. Providing unsolicited advice. D. Dismissing the speaker's concerns. Answer B. What is the importance of avoiding assumptions in active listening? A. Assumptions can lead to misunderstandings and errors. B. Assumptions can improve communication. C. Assumptions can help build trust with patients. D. Assumptions can speed up the patient care process. Answer A. What is a technique for using body language in active listening? A. Avoiding eye contact. B. Frowning. C. Nodding. D. Crossing your arms. Answer C. What is the importance of being patient in active listening? A. Being patient shows that you don't value the patient's concerns. B. Being patient can speed up the patient care process. C. Impatience can cause misunderstandings and errors. D. Impatience can improve communication. Answer C. What is a technique for active listening? A. Interrupting the speaker. B. Multitasking while listening. C. Summarizing the speaker's message. D. Providing unsolicited advice. Answer C. What is the importance of empathy in effective listening? A. Empathy can lead to misunderstandings and errors. B. Empathy can help build trust with patients. C. Empathy can speed up the patient care process. D. Empathy is not important in effective listening. Answer B. What is a common mistake in active listening? A. Assuming you know what the speaker is going to say. B. Interrupting the speaker frequently. C. Dismissing the speaker's concerns. D. Providing unsolicited advice. Answer B. What is the importance of active listening in healthcare? A. It can lead to misunderstandings and errors. B. It can improve communication and patient care. C. It can speed up the patient care process. D. It is not important in healthcare. Answer B. What is the importance of using body language in active listening? A. It can convey interest and understanding. B. It can speed up the patient care process. C. It can lead to misunderstandings and errors. D. It is not important in active listening. Answer A. What is a technique for avoiding assumptions in active listening? A. Asking clarifying questions. B. Interrupting the speaker. C. Assuming you know what the speaker is going to say. D. Dismissing the speaker's concerns. Answer A. Thank you for time and attention. Contact information for further discussion or questions.